Welcome to Cenegenics Live, The Truth Exposed. On the line we have Dr. Mickey Barber, Age Management Specialist and CEO of Cenegenics Carolinas, as well as two current Cenegenics patients, Dr. Bob and Sherl Reindollar. We're offering a special holiday promotion at the end of this call.
Welcome to the call, everyone, and thank you so much for Bob and Sherl for joining us on this call tonight. And I'm going to start out by asking, Bob, if you could tell us a little bit about your medical specialty, and then if you could tell us how you learned about Cenegenics.
Gastroenterologist and hepatologist. I've spent most of my life working with liver patients, a lot of which have metabolic syndrome or have diabetes and non-alcoholic fatty liver disease. But I also am a gastroenterologist and do those things that all gastroenterologists do, colonoscopies and endoscopies, and see patients with a lot of GI disorders. I found out about Cenegenics because of your famous ad, and that's the Jeffrey Life ad. And that ad, how does this 69-year-old doctor look like a 35-year-old? And I have to tell you, at the time that I saw this over and over in airports, in the airport magazines, and in our local Lake Norman magazine, I was feeling really pretty bad at that time. I had gained about 50 pounds. I had no energy. I did not sleep well. I couldn't even bend over to tie my shoes. I felt so out of breath and was deconditioned. And quite frankly, I had lost a libido, which was a very strong part of my life in the past. And I thought, I don't know what this guy has, but I want some of it. And that's when I finally made the call.
Great. Well, let me ask you a question. How old are you, Bob?
61.
61. And so were you feeling like you were 61? Could you put an age on how you felt?
I have to tell you that I, for the first time in my life, felt that I was aging significantly and that I was over 60, and I felt like there was nothing to look forward to. And I knew the aging process had started, and all of a sudden I thought, where did this come from?
Yeah. Well, so you saw the ads, and sometimes people see those ads of Dr. Jeff Life without his shirt on, and they say, oh, my gosh, that can't be true. Were you a little bit skeptical when you saw those pictures of him?
You know, I mean, you're always skeptical, I guess, to a certain degree, but I felt so bad, and, you know, I'm the eternal optimist, and I thought, again, I want to look like that man. If he can do it, I can do it. Because I'm pretty driven, I'm pretty focused when I do the things that I do. And, oh, by the way, Dr. Barber, you might want to trade me off for him sometime.
We have a volunteer for a new ad. Great,
right.
Great.
That's right.
Well, let me ask you, so you're a physician. Why not just take care of yourself? I mean, did you feel like you had tried?
No, I mean, and, you know, and that's, I have always tried, you know, I've tried many different diets. And I've tried every diet known to man, and I've tried to, you know, over my 50s, I did the Sugar Busters, I did the Weight Watchers, Atkins, and South Beach. And unfortunately, I didn't realize that every time I lost weight, I also lost significant muscle. And by the end of my 50s, I was extraordinarily weak. So what I had done for me with this yo-yoing of these diets every couple years, I would lose weight, I'd gain it back, but I never gained back the muscle. I didn't know that. And at the end of my 50s, I couldn't even do a push-up. I used to swim laps. I still do some, but I couldn't get on the ground to get in the pool. I couldn't hoist myself out of the pool, and I couldn't understand why I was so weak, and furthermore, why I was so inflexible. But, you know, no, I'd done everything I could do.
So I know that you have a lot of physician colleagues that are perhaps more conventional, so why not see some of those doctors who are there in your area and who are obviously experienced and well-respected?
You know, there's no question that my colleagues, internist colleagues and family practice colleagues, do a phenomenal job at what they do. But I have to tell you that, you know, I get their patients, I see their patients, and when it comes to nutrition, they're so busy they tell their patients, you need to lose a little weight, or you need to go on a diet. Have you tried Weight Watchers, or have you tried this or that? I also know that when it comes to hormone replacement therapy, I thought there was probably a good chance that I might need some hormone replacement therapy. And I have to tell you that the primary care physicians, you know, just are not in tune to that at this point in time. And what I've seen, they really don't know which test to order, what blood test to order, and they really haven't been trained in how to do hormone replacement therapy when it's appropriate.
Now, when you first came to see us, Bob, your wife did not come as a patient, and had you talked to her a little bit about it before you came?
Yes, she was more skeptical than me, and she thought I was crazy. But I have to tell you, that I really felt bad not only about how I felt, but I felt bad because we had always had an active sex life, and for about over a year, it had been non-existent. And and as I come to find out, I'm probably no different than any other couple. We didn't talk about it. She didn't have a libido. I didn't have a libido. I didn't know why I did, and I thought it was the aging process. But when I finally told her, I said, I want to find out what's going on. I want some help. And she was very supportive then. But she was still skeptical.
Sure. Well, Sherl, hello. Welcome to the call.
Yes.
Bob's lovely wife, Sherl. So tell me, so you did not come to see us when your husband first came.
No.
Can you explain a little bit about what held you back?
Just skepticism. We would look at the ad and we would think, ha, 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 like I think a lot of people do.
Sure.
But now the ha, ha, ha is on us. But I was very happy for him that he was going to do it. But I thought, well, I'll let him try this out first, which he did for a complete year while I watched and was so proud of him and his efforts and how he got along with it. And then I knew that it was time, and I told him about probably 6 or 7 months into his first year that when he went back for his yearly meeting with you, that this time I think I'd better go with you. And as the year progressed and the worse I felt, the better he felt, it was clear I'd better go with him. So that's how we set it up.
And how old are you, Sherl?
I'm 58.
And tell me a little bit about what you were experiencing or what you had, because I know you're an interior designer and you had not been working in a few years and also had some, at least one major surgery. So maybe you can kind of tell us what had been going on with you over the last few years, I guess maybe around the same time that you experienced menopause or sometime after that.
Well, during that, I had several surgeries. I have a terrible back and scoliosis, and I had quite a few major surgeries. And with each one, recovery time was longer and longer. And naturally, at the end of those, I had 5 in 3 years. And I had no strength, and I knew I had to do something. So I started with the physical therapy program locally. It wasn't prescribed, but I knew I had to do something to get a little bit stronger. And got a little stronger, but nothing like it used to be. I did not have my life back. And also with menopause, the hot flashes, they were horrible. And then one day my doctor said, you've been on these hormones long enough. It's time to go. You just stop them today. You'll be just fine. Well, I wasn't just fine. So along with feeling so weak and discouraged, and now hot flashes all the time, it made it even worse than ever. So all that sort of happened as Bob started this program, and just another reason for me to jump on the bandwagon.
So your physician decided to take you off of hormones. Were you on what we think of as being sort of typical synthetic hormones, like Premarin?
Yeah.
Yes.
The same thing as all your girlfriends are on, and no one knows why. It's just because they say so. But they pull you off of them, and you feel worse than you did before, and the hot flashes don't end, and where do you go from there?
And were you struggling with your weight somewhat over
goodness, yes. I always have, but like Bob said, we both up and down, and we were never obese or anything like that, but enough to not feel good in our skin, so to put it. So yes, that was definitely an issue. And once I was off the hormones, it even more so. And by the end of all the surgeries, I was at the highest weight I've ever been for me.
Now I remember, Sherl, when you actually Bob is Dr. Collender, my partner's patient, and you're my patient. And I remember when you came to see me that you were pretty down, and I remember telling you that you might not see benefit as quickly as your husband had seen it, I told you that that's one of the unfair things that women, it tends to take a little bit longer. But we were both kind of pleasantly surprised. So maybe you could tell a little bit about what kind of benefits you noticed and how soon they started to happen for you, Sherl.
Well, that day was the worst day of my life, and it was the best day of my life. To realize what horrifying shape I was in and be faced with, just the realization of it completely was devastating. At the same time, the hope that I could see what had happened with my husband, and after talking with you, found that, felt the same sense of hope for the future if I would just get on the program and do my thing, which I immediately did. And remarkably, it did not take that long. Within weeks, I could tell the difference, just a few weeks. I felt better each day. The night sweat stopped. I slept better. I had more energy. My endurance level, exercising increased. Libido increased. Just general well-being all around increased very quickly. And the weight loss, really, once I followed exactly what I was told to do, it really came off very quickly. I was very, very happy with the results.
Mm-hmm. Well, it's interesting, and I would love to be able to take, most of the credit for your success, but I have to, and in both of your cases, really commend both of you for taking the program home and really, being 100% committed. And just for new listeners on the phone, the program is really many things: exercise, nutrition, lifestyle, and then hormone or endocrine balance. And I know for you, Sherl, we really sort of slowly ramped your exercise program up over time, and I think you were a little skeptical that we'd be able to do that. But what kind of exercise are you doing now, Sherl?
I do interval training 3 days a week, sometimes 4. It's just been wonderful. I amaze myself at what I can do now. In the beginning, I couldn't lift a 2-pound barbell.
When you just said interval training, I thought, oh, my goodness, I never would have thought I would have heard those words coming out of your mouth.
It's great. I can't wait to go. I have a terrific trainer, and it's been a wonderful thing. And now I'm doing 20-pound chest lifts and 130-pound leg presses and things other people can do that I was not sure I would ever be able to do, and have fun doing it. So it's, now I know that it's part of my life and always will be, if I want to grow old gracefully, and heck, we're there. So
yeah. Well, good for you.
It's fun, and it is.
Yeah, well, it should be. That's for sure. I just want to mention here that when we talked, Sherl, I mentioned a synthetic hormone, which is kind of what we think of typically as being Premarin for women. And we do use what the term that we're most familiar with is bioidentical hormones. And what that really means is that it is the chemical structure of the hormones we have in our body. And typically they do come from some plant source, and that is for men and women. And Bob, as a conventional physician, and I'm guessing that you didn't learn a lot about hormones in general, particularly men's hormones in medical school or your training. Is that right?
That's exactly right. And, and that's one of the things that is so clear is that most medical doctors do know very little about hormones. And as I've learned to know so much about hormones and actually have gotten certified in age management medicine, it's clear to me that there is this huge need. You don't have to look at the television to see all the ads on the television by Abbott Labs on men. Do you not have the zest for life? Do you not have the passion? And everybody knows the commercial to know that this is huge. And we now know that a huge number of 40-year-olds even have no testosterone. So we didn't learn that, but I think in the future it's going to have to be a major thing that most doctors become familiar with and learn to help their patients with, because this has been a huge thing for a lot of my patients that don't have energy. They're losing their body composition has changed dramatically. They don't have the strength they had, and they don't have the libido. And a lot of them are in the 40s, and they're not talking about it. Well,
how about just if you think about the evaluation itself, Bob, can you kind of describe so that listeners on the phone can understand what our evaluation is about,
and that's what sets you apart from the other hormone clinics and also from the family doctors and the doctors at home. This is a hugely comprehensive program, and before you ever go for your executive physical, you have filled out this very extensive questionnaire about your own health, your family history, your physical endurance, your personal life, and it's very extensive. And then you've had a huge blood panel drawn prior to the time that you go down for your Cenegenics appointment, and which measures everything from thyroid to your hormones to your blood count to your chemistries and kidney function and your liver function and all these things and your lipid profile. And then you get down there, and in the morning you get there, you immediately have a DEXA scan. And this is a scan that not only measures bone density, but it measures your exact fat content, and it is the most accurate way to measure your fat content. After you have the DEXA scan on that first morning, you meet Jeremy Jacobs, the exercise physiologist, who assesses your physical well-being, your fitness, your level of fitness. And he'll see how many crunches you can do, how many push-ups you can do, your strength. He's going to look at your flexibility. And then he does what's called a VO2 max. He hooks you up to a bicycle, to an EKG machine, and puts a mask on you to see your cardiovascular or your cardiopulmonary fitness and your level of fitness. Where are you starting from, so that you have a place where we can go further and improve. And then after all this, he spends a long time talking to you about nutrition, and he looks at what has been your typical dietary habits. And then he looks at what can we do to modify them and change your diet. And it is extremely helpful. It's the first time in my life I know how to eat, and I've changed how I eat because of Jeremy. And then he gives you a exercise program. And everybody, it's clearly different. I mean, some people have to start from scratch with just walking, and other people start with much more intense exercise and with resistance training. So this is what you do for the morning, and he spends several hours with you. And then after this, you take a cognitive test online. I mean, it's on the computer, which is a memory test, and it's not only good to see have you had any aging effects with your memory, but it's a good baseline for when you come back for your yearly exams. And the afternoon I spent with Dr. Collender, my first day, and Dr. Collender, who has been very helpful to me in many, many ways as my physician there, does a complete physical, and he checks everything from head to toe, including the prostate, which is very important. And then he reviews your questionnaire that you sent in. He reviews all your labs and everything that Jeremy's done, your DEXA scan and your cognitive tests. And then he answers any questions, and he comes up with a health plan for you at the end of the day. But he spends several hours with you in the afternoon. And when you go, then he decides, what are we going to prescribe for you? What do you need with supplements, with hormone replacement therapy, with all these different things. And so it's a comprehensive program unlike any other.
So, wow, that's a long day. Do they feed you lunch while you're there?
I was never fed a doggone thing and was fed. We had a very nice lunch and a very healthy lunch. I may add. It was very good. Yes, they did.
Yeah, we have to feed people while they're here. That's for sure, because it's a long day. Now, Sherl, so we have made some nutritional changes in your eating plan. Was that hard for you to do? Were they difficult things?
No, actually, they weren't. Went on a low carbohydrate diet, and that's mostly given up anything white, and that was actually, it was very easy. I was so ready for a change of some kind that I enjoyed it. I haven't had a white potato in 2 years, and I don't miss it.
Well, good for you. Good for you. Let's talk a little bit about follow-up, Sherl, because some people, when I talk to them and they're interested in our program, they say, well, I've been to the Mayo Clinic for their executive health evaluation, and I do think that the fitness evaluation and the hormone evaluation certainly is distinctive from other kinds of evaluations. But let's talk a little bit about the follow-up, because once you complete your day, then you are put on a follow-up program. Can you speak to that a little bit, Sherl?
Well,
how that works?
It's wonderful, and it really is one thing that I think Cenegenics is so strong in. Periodically, every 3 months, I think, or somewhere around there, we do another blood draw to see what your hormone levels are, and not just your hormone levels, but all of your blood levels. And it's a very easy blood draw. The phlebotomist comes to you, and wherever it's convenient, or if not at your home, and it's very easy to do. And then once your labs are read, they are emailed to you, and a phone call is set up with your doctor, which in case, lucky for me, is you. And we set up a time that you will call, and then never a hurried conversation. That's the great thing about Cenegenics. Your doctor is only a phone call away. A phone call, an email, anything that you might have any concern about, or if you need to talk to Jeremy about nutrition or your diet or a recipe even, whatever. But follow-up is just excellent. You all do a terrific job of making sure that you're right on there every time. Nothing ever lags behind. And if there are changes to be made, they're made immediately. I think you and I just made a change in one of my prescriptions from the last blood draw. So, several times a year.
Good. So you feel like you have people that are looking out for you?
Oh, absolutely, all the time, and they're looking after you. They're not in a hurry. Nobody's ever like, well, I only have 2 seconds, and no, it's a one-on-one, and it's an easy conversation, and no, it's a wonderful, wonderful practice.
Well, one of the things I want to throw in now, because I don't know if you two have even been able to benefit from it, but we do now have an online program, which when new patients come on the program, we sign them up for that program, which is really, we download their exercises into their nutritional recommendations, so they can be logging in what they're eating or what exercises they've done. So it can be very interactive, and we now are enrolling our new patients and our patients on their annual evaluation to come in and use that as another tool. That's another thing that we recommend, is that patients come in every year for their reevaluation. Bob, can you talk a little bit about that, how you might see that as being beneficial or different than what you've been used to?
Back for the reevaluation, once again, you have a follow-up DEXA scan to see, what is improved in your fat content and your bone density. And I'm happy to report that this year I went from a 73rd percentile in body fat 2 years ago to the 3rd percentile for my age. So,
wow.
It was terrific. And then again, we go in and Jeremy gets to assess us and watch me do 100 push-ups and 100 sit-ups or whatever, and then we repeat the VO2 max to see how has our fitness level improved. And and then again he discusses with us nutrition and any questions that we have about our nutrition and about our exercise program. And Jeremy really is a very brilliant guy that is a truly a very well-trained exercise physiologist who can really hone your exercise program down to just a great level, and he can also work with your trainer and talk to your trainer, and he really does a great job with that. And then once again you take the cognitive test, and the cognitive test they can compare to last year. And with Sherl, there was a huge difference, as you well know, and there had been a decrease in her memory significantly. And Dr. Barber, you pointed out you thought that it was probably sleep apnea, and within a week we had sleep studies, and Sherl was found to have severe sleep apnea, and they feel that all the memory problems that you identified because of the cognitive test were related to the sleep apnea, and she's already better. And then again in the afternoon, I see the doctor. I'm examined by Dr. Collender, and spend a lot of time with him and make suggestions how we can improve the things that we're doing. So again, it's not quite as intense as the first time you go, but it's wonderful to see how you've improved and also to get continued suggestions of how you can even get better.
And to reset your goals. I mean, obviously,
right.
You two are different physical specimens than you were when you started on the program, so your goals are going to be different for the upcoming year. So that's one of the things we think is important to do then. So, Bob, if you could just, because both of you kind of came into the program with some concerns, energy concerns, sex drive, needing to lose some weight. Well, what about the people that are on the call that say, I feel pretty darn good. I'm doing a lot of the right things, and, I just don't know how this program would be what I'm looking for. Bob, can you comment on that a little bit?
Yeah, I really can. I mean, I think that, for anybody that, feels pretty good now, I think that there's no question that we are all going to continue to age. And we're also very, very much concerned about disease prevention, preventing the aging process, preventing things that are going to happen as we age. And so, I think it's a wonderful thing to get a baseline of where we are. We may be surprised at some of the deficiencies that we have on our blood tests and some of the things that we can improve with our even with our exercise programs. I mean, one of the things that has shocked me, for instance, is that many people think that complete cardio is the way to go, and that cardio is the way to lose weight even. And as it turns out, what you all taught me and what Jeremy taught me was the importance of resistance training. And the old weight trainers and the bodybuilders always knew that resistance training was one of the best ways to lose weight. But then we also found out that interval training through Jeremy was far more effective than just running for 30 or 40 minutes at a slower pace doing intervals. And so there are many things that even if you think you're doing great and you think that you're in great shape and you're in a good position where you are, the things that having a true exercise physiologist who actually has trained Olympic athletes, Jeremy, is something that is invaluable. But also, we just want to prevent that aging process. And I'll tell you what, I feel absolutely like I did in my late 30s. And I feel that I have put off this aging process hugely, and I'm ready to go. I can work another 10 or 15 years.
Mm-hmm. Well, given the current economy, it looks like most of us will be. So we have to stay in good shape to be able to keep it up. Sherl, so, everybody worries that they just don't have enough time. No one's got time for anything. I mean, can you talk a little bit? I mean, has this been a big time investment that you've had to put into this?
No. You have to initially figure out when you're going to exercise. I mean, that's such a key part of it, but it's going to be forever. So you might as well fit it into your day, and it wasn't hard for me, and I feel so good that I'm going back to work next month, a couple of weeks from now, and I've worked around it. I've already got my days and my time set up, so it's just something that you have to make a place for in your day. It's no different than any other appointment, so you just make it as an appointment that's part of your day, and
the most important appointment of your day.
Absolutely.
It really is. Bob, let's talk a little bit about money for a second here. A lot of people, we don't take insurance, and, it's not an inexpensive program. Can you talk a little bit about that? Is it worth the investment?
Oh, my gosh. I mean, it's interesting. It is not inexpensive, but I can tell you that I intend to do it as long as I can possibly afford to do it, because I don't think that I can afford not to do it. I mean, I just don't know how to say it. I mean, you can't put a price tag on your health, on your well-being, and I haven't found another program out there that could come close to this. And even though it may be, relatively expensive, if that's a relative term, because again, when I look at the other programs that you see that are advertised, and I have patients that go to these other clinics, they do nothing but write a script for hormones, and there is no exercise physiologist, there is no DEXA scan, there is no cognitive test, there is no, you can call back every day to talk to Jeremy, you can call Dr. Collender whenever you want. There's none of this. So you get what you pay for at Cenegenics, and we will continue to do this, and if I have to work to pay for it, that's exactly what I'm going to do, because I can't imagine stopping it.
And on that note, I would like to thank Bob and Sherl for really being great. And I have to say that one of the real reasons that I love what I do is having these kind of patients. And when I do the follow-ups, I tell Sherl every time I talk to her, it makes my month, not just my day, but makes my month. What I'd like to do now is open it up to questions. And I'm going to turn it over to Josh, and Josh is going to explain to those on the call how to ask a question. And I'd also encourage those of you to ask questions. You know, I know it's kind of hard because we're talking about your health and medical issues, but just give us your first name, and that's all we ask. Josh?
Okay. At this time, if you have a question, press the number 1 once on your touch-tone phone. Keep in mind, pressing the number 1 more than once will remove you from the question queue, so be careful.
We'll give you just a couple of minutes because I know it takes a little while to register in for the questions. And we do have a couple questions that were emailed to us earlier, so I think 1 or 2. So we'll get to those after we answer your questions. Josh, do we have any out there?
Are you ready for a question?
Yes. Mm-hmm.
Okay. Our first question comes from Mark Cecil. Mark, your line is open.
Yes, my question is for Bob. I'd like to know, were you prescribed human growth hormone?
Yes, I was.
Okay.
What question?
Go ahead.
Do you have more to that question? Go ahead.
No, I mean, I probably wouldn't want to take up everybody's time. I'm just, very curious and interested in that aspect of the program.
Sure. If I could just comment on the growth hormone, probably about 15% of our patients are on growth hormone, so it is not necessarily a first-line medication for all of our patients, and rarely is ordered during the first go-round of medication. So we only use it if we find that the patients are deficient in growth hormone, and we use a number of criteria to evaluate that. Another question, Josh?
Yes, our next question comes from Greg Dent. Greg, your line is open.
Yes, thank you. I'd like to know if you've realized any joint pain from using any of the medications, the vitamins, or anything that you've been utilizing.
Let me repeat the question a minute. Is the question, have they noticed any joint pain from the vitamins? Is that what you said?
Yes.
Sherl, Bob? Sherl, you want to go first?
Well, actually, I've noticed less joint pain. I have one knee replacement, and my other knee, it was just, they said it was just a matter of time before it's done, too. Actually, since all the exercise started, and I don't know if it has to do with the supplements and vitamins or not, but I don't have any knee pain in that knee anymore at all, ever. My joints feel better than they felt in years.
I have to also tell you that when I first started, I had some joint pain, and I took the joint supplement pack for about a year. But again, after I started doing more exercise, I found I didn't need it. And another thing that was very interesting to me was my knees used to swell when I was doing heavy exercise early on. And one of the things that my trainer does is huge leg exercises and resistance training twice a week, Mondays and Fridays. And since my legs are much stronger and my joints are stronger, and I really don't have joint pain at all anymore. And I used to have a lot of joint pain. But if you're talking about any of the supplements, the growth hormone, the testosterone, or anything like that, I have had no side effects of any of those, no joint pains, no leg swelling, nothing.
Okay, good. Another question?
Okay. Our next question comes from Andrew Johnson. Andrew, your line is open.
Well, yeah, my question would be, do you think, when you're in your mid-40s, you mentioned something about the 40s, just in general. I was just curious if you think that's too early to start this program.
I'll let Bob and Sherl answer, and I'll give you my answer. Go ahead.
I'll tell you that what was shocking to me was I recently did a training with Cenegenics for age management medicine, and there were 10 doctors that were trained. 7 of the doctors were in their 40s. Not a single one of those 7 doctors who looked pretty normal to me had any testosterone on board. But they already had some little belly fat, and they said they had some decreased energy. And I truly believe that this is much bigger than we even imagine. the low testosterone in 40-year-olds and probably in some late 30-year-olds. And I think that the tragedy is that this obesity epidemic that's occurred in America has collided head-on with a hormone problem. But I think that absolutely the benefits that you can get. The other thing that you need to know is, and that I didn't know, is that we really reach our peak of how we feel by the mid-40s, by 45, and then it's downhill. And so there's, without a doubt, everything starts in decline. So that's when if I were to do it over, I would have started this in my mid-40s so that I could have warded off all those things and I could have prevented feeling the way I did in my 50s and to my early 60s.
Sherl, what do you think?
I agree with that completely. I don't have anything to add.
Yeah, well, the other way to think about it too, Andrew, is, it's never too early to have a proactive preventive plan in place. I mean, even if you're feeling good, and I mean, I can tell you quite frankly, I don't think we've ever gotten a 40-year-old in there that we didn't find something we could help them to do better. Any other questions?
Yes, our next question and last comes from Guy Alsop. Guy, your line is open.
Hi, I'm just curious, do you have offices at all in North Carolina?
You know what? Our center serves North and South Carolina. We're in Charleston, South Carolina, and we need you to come to our center for an evaluation, which is, as we said, about 6 hours, and then the follow-ups we do by phone. Most of our patients do not live in Charleston. Most of our patients come from out of state.
Okay.
Another question?
At this time, there are no more questions in the queue.
All right. Well, I think that Josh has some information to give you all as far as contact information. But again, I want to thank all of you for being on the call, and of course, wish you all happy holiday. Josh, you want to give them the information, please?
Thank you for calling in. Please take advantage of this holiday offer. Secure your executive health evaluation by the end of this year, and Cenegenics Carolinas will provide a 2-night stay at one of Charleston's historic hotels. Scheduling your evaluation is easy. You can call Dr. Mickey Barber directly at 843-724-7272 or email at mbarber@cenegenicscarolinas.com or call our patient services team at 843-577-8484 or register online at cenegenicscarolinas.com. Cenegenics Carolinas is open Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. Call Cenegenics Carolinas at 843-724-7272 or at 843-577-8484 or register online at cenegenicscarolinas.com. Thank you.